to Mom Lounge TV. I'm your host, Sheinina West, and today our guest on the program is Dr. Victoria Hendrick. She is a famed postpartum depression doctor. You may have seen her on Dr. Phil. She's the author of 2 published books and a professor at UCLA. Welcome.
Thank you for having me.
Today I would like to speak about the transition between woman to motherhood and how being a mother, you're always faced with sleep deprivation, weight gain, and of course there's a hormonal imbalance. As I understand, there's a peak in hormonal imbalance that happens from when a mother gives birth. And having a daughter myself, and the crying baby, and to me it's no wonder a woman would feel depressed and overwhelmed emotionally. I'd like to ask you how common depression is after pregnancy.
Depression after pregnancy is really very common, and it's great that you are addressing this in your program, because a lot of women need to know how common it is to dispel the myth that motherhood is a time of happiness and peace, and that they should be in love with their baby right away, and that if they're feeling depressed, there's something wrong with them. A lot of women have that feeling of guilt, that there's something wrong with them because they're feeling depressed. But the reality is a good 15 to 25% of new mothers experience depression, and not just mood changes, but clinical depression. And the rate goes up even higher to 50 and even 75% among women who have had previous histories of clinical depression.
When you go from being a woman to having your child and then becoming a mother, suddenly, what you engage with your friends are different. They no longer can relate to you if they're not mothers themselves. You end up, really coming onto a new life of making new friends. And I think that in itself can be overwhelming, just feeling like your identity is lost, what you've established yourself to be is lost, and now it's overwhelming. Not only do you have to reestablish who you are as a person with your child, and then create this whole new community of mothers around you.
That's very true. You do experience in the postpartum a tendency to become isolated from your previous life. In fact, there have been some people who've described postpartum depression as being a grieving process for your life before the baby was born, for that self, that pre-mom self.
Right.
It's like that part of you has died, and there's a new you as the mother.
I understand that there is a great difference between the baby blues and postpartum depression, and maybe you wouldn't mind clarifying with women who are mothers the difference between the two.
Yeah, it's an important distinction. Baby blues are very common, and most women have them to some extent. It's part of the hormonal shifts that happen in the first 7 to 10 days after the birth of the child. They're dramatic hormonal shifts, and women feel moody. It feels very much like a PMS-y type of feeling, where women will say they're not really feeling depressed, they just feel fragile. They cry for no reason, they get upset for no reason, and women will often say to me it feels biological to them. But that should resolve by 2 weeks postpartum. If it hasn't, then we get concerned that it might be going into postpartum depression, which is more severe, and women are genuinely depressed all the time. The definition of postpartum depression is at least 2 weeks straight of being depressed.
Is there a concern in postpartum depression that the children suffer?
Absolutely. In fact, my original interest in this topic was because of the impact on children. The effect on children is so dramatic that it's one of the reasons it's really important for women to address this, to recognize this, and to get help. Children of women who've been depressed are much more likely to have insecure attachment with the mother. As they get older, they don't do as well in school. They're more likely to be aggressive.
Oh, wow.
They suffer more problems with self-esteem.
What are the common symptoms of depression?
The common symptoms for depression in new mothers are actually a little different than they are for depression in general. But the most common symptoms are what we call anhedonia. It means a lack of interest in things. A woman might have liked going out with her friends, or going to the movies, or watching something on TV, and none of those things are interesting to her anymore. Nothing brings her joy, not even her baby brings her joy. Poor concentration, difficulty sleeping, even when the baby is sleeping, they can't sleep. Changes in appetite, it can go either way, whether they're eating less or they're hungry all the time. When it gets really bad, there can be thoughts that they just want to die. And one of the concerns for me as a psychiatrist is when a woman, a new mother, is experiencing thoughts of suicide, it's doubly alarming because we worry not only about the mother, but mothers who commit suicide often take the child with them. So
wow, that's absolutely frightening. Do you find that women face any sort of insecurity of really opening themselves up and being honest that they are depressed and being looked at differently?
There is a lot of shame of women feeling there's something wrong with them as mothers, that they're feeling depressed. They have this beautiful baby, and yet they're feeling depressed and not excited about it.
And you're a mother as well. You have 2 sons. And I would like to ask you, if you don't mind, if you've experienced depression.
I did experience some depression after the birth of my first son. I have 2 boys. And the first few months I thought, boy, everything's going so smoothly. I'm loving this. And I thought, I'm out of the woods. By the time I got to about 5 months postpartum, though, I began to really feel depressed. And not only depressed, but I had an obsessional quality that everything had to be very perfect and neat. And that's actually one of the things you do see with postpartum depression is an obsessional quality to these depressions, where no one can touch the baby or hold the baby except the mom. The mom's always worrying about the baby's hygiene, and the house isn't clean enough. And there is that very distinct quality to postpartum depression of having these like obsessive compulsive qualities. And so it reminded me when I had this experience that there is a second peak of postpartum depression. The first is in the first 4 to 6 weeks after the baby's born, but there's another peak in the risk of depression about 5 to 6 months postpartum when women start to feel just really burnt out.
Right. Well, I understand that. I do have to say, how is postpartum depression treated?
There are a number of ways for treating postpartum depression. For milder forms of depression, the best is to be in a support group with other mothers. I'm a strong believer that being in a group with other women and seeing how common the experience is incredibly therapeutic, because women start realizing that there's nothing odd or abnormal about them, that they're really part of a large number of women who experience the same thing. Just in times when depression gets really severe, which luckily is not the majority of the time, but you never know, there are occasions when women will get into really severe depression. It's important to know that antidepressant medications can be really helpful. And a lot of mothers ask me, is it okay to breastfeed if they're taking an antidepressant? And there's so much data now on the safety of certain antidepressants that it's no longer a reason to deprive the baby of the breastfeeding, because that's the best thing for the baby, and the mom can still get the treatment, which ultimately is also the best thing for the baby, to have a happy mom.
Thank you for your time and for educating all the moms of the world, and thank you kindly.
Thank you for having me.
Thank you for joining me on Mom Lounge TV. I hope you've enjoyed the show today, and please, if you feel like you need help with depression, don't hesitate to reach out to Dr. Victoria Hendrick. She is available in the Los Angeles area and happy to help the women of our community. Thank you.